Ms. Laney, would you please do the honor of leading us in the pledge, please? Allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, notwithstanding of anything else that's going to be happening later in the evening, do we have any public comment right now? Okay. The March 2nd, 2022 minutes were sent out for review. Does anybody have any additions or corrections to the minutes? May I have a motion? Ann, in a second? Okay, yeah, okay. All in favor? Okie dokie. Correspondence.
I sent those out. I do have a modification to the email that I did send out. I forgot I had another email that was sent earlier in March from Stat Medevac regarding staffing modification proposal changes. I will update my thing and send it out again, but we received that. We received paperwork from the New York State Department of Taxation and Finance for our application and for exemption and corporation franchise taxes. Gloria Grant Alfonso for suicide prevention and intervention course on May 13th and 14th. Come Mercy, letter for approval of Dr. Jillian Smith for physician representative for the REMAC, and lastly, Hogan Willig for statement of for general matters. That's all I got.
Okay, we're doing motion?
Nope.
No, I didn't think so. I'd like to backtrack a second. I should have done this right after the pledge, but I would like to take a moment to remember our lost partners at Mercy Flight EMS and Bell Aircraft and pray for their families and friends. May we all be reminders of the riskiness of our business, and let's all try to be safe out there as best as we possibly can. Okay, the treasurer's report, Madonna.
I emailed the report this afternoon, and I also have copies here if anybody would like a copy. The only expense since our last meeting was the $500 for South Wales Fire Department for the use of their hall, the fee for use of the hall for our meetings. I have since received, I do have a bill from Hogan Willig, which was through March 31st for $1,140, which will be paid. And I do have the new quarterly invoice from UBMD for this quarter. Does anybody have any questions on the treasurer's report? I am still waiting to receive some of our reimbursement from the state. Evidently, some of their vouchers that they submitted had our old vendor number on them, so they had to correct that. They had to re-upload everything, so I'm still waiting on that. But they feel that everything will be approved. We should have that electronically transferred, the amount electronically transferred to our checking account soon. And also I had inquired as to the new contracts that will be coming up for July, starting for July. Usually it's a 5-year contract, and I was told that variables will be changed, and they will let the agencies know of any changes. So we'll keep everyone posted on that. Any questions?
Okay. May I have a motion to accept the treasurer's report? Bill? Second? Ann? All in favor? Any opposed? Okie dokie. Okay, I have the Medical Advisory Committee. Who is that?
Greg.
Great, okay, never mind. Mr. Gill is on his way back from Florida. What?
You have the chair here.
Oh, we have a chair here? Oh, we have a chair here. Oh, hi, Medical Advisory Committee.
How are you?
Good, how are you?
Good.
Okay, would you like to come in
Sure.
to dispel your wealth of knowledge?
It's a very short report for the REMAC. The meeting coming up on the, I believe, 18th is canceled because it occurs during EMS week, and it actually is that day. There's a lot of hospital activities for EMS. So the May meeting is canceled. We'll meet in June, on June 15th at 1 p.m. Location TBD. Additionally, there's guidance that's going to be coming out soon. The newest edition of the collaborative protocols that took effect on April 15th contains some new interventions for paramedics in terms of hypotensive trauma patients. And those are tranexamic acid as a medication option and transfusing blood. TXA is a safe medication that's pretty tried and true. We use it at ECMC all the time. That is available for agencies to start using immediately if their medical director decides to do that. All they would need to do is send a letter to the program agency and to the REMAC just saying that they have a training process that they're satisfied with and that they have a QA or QI process that they're satisfied with, and that's good enough for us. In terms of blood transfusion, there's a lot of regulations and things that yet need to be written about that, so the guidance is just I would defer, moving forward on that until we get some more information from the Bureau of EMS, the CMAC SEMSCO, and or the Wadsworth Center is the lab that's going to oversee that. But that concludes my impromptu report.
Okay, thank you very much. Any questions? Okey dokey, thank you. Thank you for speaking up, Brian. Okay, Brian, do you have anything from the State Council?
State Council met 2 weeks ago and largely said that they should do all the things that they said they were gonna do and keep working on them.
Okay, that makes sense, that's about right.
And I believe that was actually in the form of a motion.
Okay. Any questions? Okey dokey. Do we have an Erie County report other than from Mr. Gill? Nope, okay, Mr. Stryker.
Just a couple items. The CLI class is scheduled we're working with Erie County on. It'll be held in Wyoming County, and that'll be May 14th and 15th. And we get quite a bit of interest on that from surrounding areas as well. So hopefully it'll be a decent sized class. Unfortunately, our COVID numbers are creeping up in our local hospital, as well as in responses for volunteers across the county. And then we're also working on pulling together a peer review for mental health issues across the county. We started some training a week ago that was fairly well participated in, and we got one more offering coming up, which is open to everybody, that was shared with all the counties, Western New York counties. You just need to register to take it. The ongoing issues with mental health in the fire EMS community is pretty significant, so we're going to try and pull something together for a local level. Hopefully cut anybody struggling off in the past before they go down that dark alley. So, end of report.
Okay, any questions?
Phil, did you change the dates for the CLI class? Because they were over 2 weekends and now you have it condensed in 1 weekend.
It's 2 weeks, 14 and 21.
Okay.
Did I
You
say
said
that
14
wrong?
and 15, so I was confused.
What's that?
You just said 14 and 15.
Oh, I'm sorry. It says 14, 21 right in front of me, so I just can't read.
That's okay.
Yep.
So what are the dates?
May 14th and 21st.
Any other questions for Bill? Okay, Western New York stress. Anything, anybody? Okey dokey, moving on. Okay, Madonna Budget Committee.
The Budget Committee has not yet met. I will be getting in touch with the members shortly to go over budget items for the upcoming new contracts, which we don't really know what they entail fully yet. If anyone has any suggestions or ideas of what we can look at that may be able to be covered under our budget, what they feel that might be necessary, could you please get in touch with me and let me know. Anyone have any questions? questions?
Anybody? Okay, all set, Madonna, then? Okay, good. Okay, Ann, membership.
Nothing new. Erie County's got their 13 members, 4 alternates. Wyoming County is still short 3.
Okay,
No pending.
okay, any questions for Ann? Systems Committee, Brian.
No report.
Okey dokey. Training and Ed, Chris.
Nothing to report.
Is Eric here for bylaws? Anybody else have a report on bylaws?
I can just ask Attorney Mahoney, do you know where we are? And I know there was a draft.
It was, yes, I guess I'd say, I mean, and part of those revisions are taking an eternity because of me and my schedule, so, but I think, you know, at the risk of jinxing myself, probably within the next month or so, we'll be circulating some stuff and getting it going again.
Thanks.
Any questions for Kevin or Brian? Okay, does anybody have a report for Mr. Gill from awards or public relations?
Carol?
Yes.
I had spoken with Mr. Gill after the last meeting, about sending a request, a written request from him to our state agents, our state representative, or personnel, to see what would actually be covered, or to give them more details of what he felt we were going to be asking to have them cover, to see if it was approved expenditures. And I'm not sure where that stands at this point.
Okay, okay, thank you. Okay, New York State Department of Health, Mr. Mager. Am I saying it wrong again? Is he here? Anybody else here from New York State Department of Health? Nobody willing to die on the sword, huh? Okay. Okay, executive board, we did have a meeting a long time ago, in land far, far away. Didn't we have one in April?
Yeah.
Do you remember what happened, Christine? I mean, we discussed the RFP process, we,
Did we talk about the awards dinner? We
Yeah,
confirmed
we're talking about the awards
Yeah.
dinner and the RFP process were the two things that I remember.
okay, yeah, but we didn't really come, other than the RFP, which was already set by then, we didn't really come to anything in regards to the awards dinner, did we?
I think we picked a date
thought
and
we
a
had the
location,
date.
I think it's
Okay.
Hillcrest.
The date's in August.
Yeah,
30th, I think it was.
31st, something like that.
Okay, yep, now that's ringing a bell.
August 31st.
Yeah.
Okay, I should have pulled those minutes. My bad, anything that you remember, Chris?
It's gonna be in Orchard Park, I guess. is what-
Yeah, it's at
Yeah,
Hillcrest.
at Hillcrest Fire Department. With assistance from Twin City and AMR, thank you very much.
If they're still looking for assistance, I can engage Monroe as well, if we still need.
Okay, you would have to talk to Greg about that, but I think he felt well funded by AMR and, Twin City. Okay, but talk to Greg about it.
I know he was anxious to solicit nominations.
Yes, that's right, he was, but I don't know if that's ended or not. I don't remember what the deadline was on that for the nominations for the awards.
I think it was,
Did we pass it?
for the state awards, they had to be to this group by June 1st, if I remember correctly, and they gotta be into the state by July 1st.
You know,
So give us time to review the committee.
And I sent an email out to the committee last night with that.
okay. Okay, thank you for helping us to piece together an executive board, report. Any questions or anything from anybody? Okay, Mr. McCartan, Program Agency.
Good evening. One thing with regards to awards, I did send, we received, it was yesterday, or the day before, I received a Vital Signs Award request. And I pushed it off to Chris, just so you know. I suppose that would have to be considered at this meeting, since there's not another one before the deadline. submitted by AMR?
That goes to the committee.
Okay.
Yeah.
All right. Just a couple things I wanted to highlight. Vital signs, again, it's 27th through the 30th of October in Albany. The hotel accommodations are now open. So if you're considering going, I would probably jump on that sooner than later. The Ems Memorial Service, in case you have not heard, was moved to September 20th. This was due to the fact that they ran out of room on the wall and they had to expand upon it. So they're going through that expansion process. As far as New York State education goes, the cards, HCS, the cards are now being shifted into HCS, both provider and instructor certifications, so that providers will be able to go on and download or print. They call it a digital copy, but it's not so digital. That process of how we're going to roll that out is coming from the state soon. Once it does, I will get with agency leadership and we will start working towards that. The other thing is there was a core sponsor call today. And in case you missed it, one of the things that was stressed is that course sponsors, CICs, instructors appear to not be communicating extremely well with our students because the state continues to get calls after calls after calls about testing after a course. They wanted to stress that nothing goes to PSI until after that end of course date, which is the third Thursday of every month. So if we can start communicating that, passing the word along, that was the request from Gene Taylor down at the state. So, as mentioned, the next REMAC meeting was canceled. That means the next scheduled one is June 15th. I would assume it's going to be a Twin City, however, that hasn't been fully announced yet. And Catholic Health is requesting that Dr. Jillian Smith be approved as a REMAC rep for Kenmore Mercy.
Okay, any questions for Rob? Okay, thank you for your report. Okay. Anything else under committees or program agency or anything I forgot about in there that isn't on the agenda? Okay, then we will move on to, Mr.
Just want to make a motion to suspend the order of business and approve Dr. Jillian Smith to the REMAC before we come back to the program agency issue.
Okay,
Second.
sounds good. Hold on a second. Wait for our secretary to catch up.
Who seconded it?
Mr. Shaw. Okay, all in favor of that motion?
Aye.
Any opposed? Okey dokey. Okay. So, we have the Kenmore Mercy approval of Dr. Jillian Smith to the REMAC. Is there, may I have a motion in regards to that? Or do I have to do something else different, Chris?
What? So he made a motion to change the order of business.
Yeah, he made
So
an
now we
order,
have to
so
make-
now we need a motion to
Approve it.
approve it. So may I have a motion? Okay, got a few. Bill, I saw it, but
Give me
I don't know people. I'm bad. I don't get to know people.
Got it.
Okay, we're good? Okay. Is there any discussion on that motion? All in favor? Any opposed? Approved.
And a motion to return to the regular order of business.
Motion to return to the regular order of business. Do I have a second to the motion? Okay, Christine. Okay. Any discussion? Okey dokey. Motion to return to all in favor? Okay, any opposed? Good. Since we're almost right at the end anyways. Okay, so going back to old business, we have the request for proposal. This process has been going on for many moons. And yes, we have extended contracts. We also had an unsigned contract or memorandum of understanding. So therefore, it got down to the point that at the February executive board meeting, it was brought up about moving forward with putting together a request for proposal, since this has never really been done, and therefore then going just to see what we would get back, and then moving forward with selecting a agency to provide our, and this would be just the council's deliverables. And it's mainly administrative is what we require. We do require some other things. Article 30 basically rules a lot of that, deliverables and requirements. And so basically what the contract committee did was to take the old memorandum of understanding and then make a request for proposals off of that. The deadline was extended to April the 18th, actually by 5 o'clock on April the 18th, even though we re-extended it again until April the 22nd due to a request from one of the submitters, and nobody had any problem with that off of my committee or the executive board. But what we did is that I received all 3 proposals at that particular point in time. Catholic Health, Southern Tier EMS, and then UBMD. Catholic Health, when we had our committee meeting on April the 26th, was determined to be not eligible, and the proposal was denied due to the fact that they are not a program agency, and it was specified in the RFP for them to be a program agency. So therefore, we have the Southern Tier and the UBMD, Southern Tier EMS and UBMD proposals to look at and consider for that. I have invited both agencies to do a presentation if they wish. Southern Tier, are you here? Okay, I see a nice man back there in a suit and tie, and they make me scared. Sir.
Came from another meeting, don't have my usual crap.
Oh, okay, we'll forgive you for that one then, okay, good. Okie dokie. So is anyone here from Southern Tier? No. Okay, anyone else willing to present for Southern Tier? Okay. Then therefore, we will consider that Southern Tier does not have a presentation. The only thing that we have is the proposal that I sent out to everybody via email. Second would be Mr. McCartan representing UBMD. I would imagine you would be the one to do, and you are welcome to state and say what you would like to state and say.
Very good, thank you. When I first took over, I didn't really have a chance to kind of introduce myself and tell everyone where I'm from. So I'm a New York State paramedic, do a lot of teaching, CIC. I've recently gotten provisional regional faculty. I am a serving paramedic. I do volunteer work up in Niagara County with my volunteer company, Rapids. I did begin my career with AMR, spent several years with them before I moved on to the program agency. The program agency at the time I worked with was Lake Plains. I was an EMS coordinator. Spent 4 years over there before I was brought on to take over for UBMD. Looking over the RFP, one of the things that I was able to determine going through it is most of the work we are currently doing and actually complying with, especially when it comes to moving toward away from paper to electronic. Digitalizing a lot of the correspondence that come in. There were a couple of things I did want to focus on. When it comes to the website, we're very well able to comply with the requirements for the website. I know a couple of years back there was some work being done on maybe a redesign, which we would be willing to work with the WEREMSCO and expanding upon that. With some of that work, there was actually some work already paid for in restructuring the brand logo. So we really would like to continue that forward with this organization. The other thing I want to bring up is, in one of the new deliverables that was put forth was domain-specific emails. I spoken to our vendor, MK Photo, who is operated by Mike, sitting to my left. And we found that the best way to offer this is through the Microsoft Business Suite. This not only gives you that domain-specific email as requested, but it also opens up a lot of other opportunities, such as Word, Excel, PowerPoint, and Teams, which we think is instrumental in moving forward towards communication. It allows a lot of opportunity to communicate individually amongst each other. You can get together in your groups, such as membership, bylaws, or you can speak as an entire organization through that system. It allows document sharing, and it also serves as a secondary platform for any virtual meetings you might want to have. Sorry. With education, since I've been aboard, I've been working diligently with Dr. Innes. We really want to try to start bringing some of the doctors, the residents, the fellows out to you guys to do some in-person, out-of-textbook education. In addition to that, we're really working forward to bringing into an LMS system. We understand that times are tough and that people might not be able to attend those in person. So with the LMS system, we're looking to kind of bring that aboard to be more presentable for them. In addition, it was suggested through the RP about conferences. I've been talking with Karen about bringing those back. We're already looking at possibly bringing one in the spring and then one in the fall. Subsequently, one would be Erie County, one would be Wyoming County. We really want to bring those back. Unfortunately, due to COVID, we were that was on pause. But now that we're kind of mitigating out of that, we really want to bring those back into there. Some of the things that I try to bring into not only the program agency, but I really want to try to bring into the WEREMSCO. I participate on a lot of councils at the state council. And one of the things that I'd like to bring as an addition to some of those duties that were specifically in the RFP is creating a feedback loop to a lot of those committees that I serve on. Currently, I serve on the Systems Committee, the Innovation Committee. I'm a part of the EMS Sustainability Tag. I do work with the Collaborative Protocol Committee. And one of the big ones that I work on is the Data State Team, which does a lot of work with the standards and the formatting of a lot of our data standards. So that's really where I want to bring forth a lot of the extra components to this RFP. Is not only being that feedback loop, taking your voice back to them, but really acting as an advocate in those cases. That's all I have.
Does anybody have any questions? Mr. McCartan? Or forever hold your peace. Okey dokey. Committee? I'm looking at Christine and Don. Would you like me to specify what we determined in committee? The differences was, I mean, there's not too much. I mean, with STEMS, it was, the contract is for $12,000. For UBMD, it is $8,800. For STEMS, we would like the regional office to be located in this region versus in Olean, and there was concern about the distance in driving. And basically for UBMD, the only thing we wrote down was the price. That was the only thing I got. Do you have anything? Does my committee have anything else? Okay. Okay, sounds good. The web domain for unique email addresses for the council. Yes, it's gonna be another email address that we're all gonna have to check, me included. However, when we put together the RFP, those proposals came to my email address, which is Carol N. Todd Waddle, which isn't exactly very professional. And probably only Bill and Madonna know where Todd Waddle is located. Yeah, that's where actually the Four Corners where I live. I guess there was a guy by the name of Todd who waddled. But anyways, so anyways, that's why we're looking at something that's a little bit more efficient, a little bit more professional, and a little bit more uniform in regards to the domain email addresses. If there are no other questions, it would be nice to be able to proceed with a preferred proposer for the contract. Do I have a motion? Mr. Brawmer?
No motion, just a comment that
Okay.
whatever, I believe the committee had proposed whatever results, that we enter into a one-year agreement and make it an evergreen agreement that will renew each subsequent year unless either party acts to terminate.
Yes, thank you for bringing that up. Thank you, Brian. I appreciate that. I left you out of the committee lineup. Sorry about that. Okay, did everybody hear that? Okay, so it will be renewable upon review each year. Okay, so it would be nice to go forward as the contract is actually, do you know when that memorandum of understanding was up? Remember, Mr. Mahoney? The previous one that or it was just kind of renewed?
Yeah.
It's been on a 5-year rotating basis. It's been on a 5-year rotating basis, so it was 12 to 17, 17 to 22. That's why we're looking at it this year. So what I would like to do is to move forward with picking a preferred proposer or a proposal. Do I have a motion as to such? And we'll see if the committee goes with it or not.
I'll make a motion to move forward with UBMD.
Okay,
Second.
we have a motion and a second to go with UBMD. Do we have any discussion on that? We're gonna take an individual vote for this as it is. Yes?
Just call for conflicts before roll call.
What's that?
Call for conflicts of interest disclosure.
Oh, yeah, thank you very much. Okay, does anybody have a conflict of interest in regards with the motion to select UBMD as the preferred proposer? Okay, nobody is stating any such? Chris will call roll call. This will be an individual vote.
Barber,
Yes.
Barcy,
Yes.
Brandon,
Yes.
Bronner,
Yes.
Lapp,
Yes.
Lemke,
Yes.
Mastrella,
Yes.
Mr. Maxion,
Yes.
McCartan,
Yes.
Peterson,
Yes.
Rogers,
Yes.
Michael Shaw,
Yes.
Staffel,
Yes.
Stryker,
Yes.
Stetzel,
Yes.
Turner,
Yes.
and Zemrak is yes as well. Seventeen yeses, 0 noes.
Okay. The motion has passed. UBMD is the provider for our services for each year, renewable upon each year. Currently, no expiration date on that.
Thank you very much.
You're welcome. We haven't done the contract yet, so don't think us yet now. So that is next. I would like to ask my committee if they would be willing to serve to formulate that contract and to get that into language so we can submit it to Mr. Honey, to submit it to Mr. McCartan.
I think we can work with what was in the RFP and the prior MOU.
Yes.
I'll be happy to get something together and circulate. And I think reading our deliverables, I think we might need the Bureau's approval of that MOU also, so.
Okay.
Wheels in motion.
So this may not take place then until the next council meeting to approve that contract, because it is something that I would like to place in front of the council. It may not be necessary, but I think it would be healthy to place it in front of the council versus it being, but the committee would present it as the motion at that particular point in time. Is that agreeable? Okay. Okay, I mean, we could have a motion to have Mr. Mahoney author a contract to be reviewed by the committee, but I don't think we really need to do that, do we? No, I don't think so. Christine's saying no, so, no, okay. Okay, anything else on that subject? I would like to thank everybody, even though they're not here, well, there is one here, besides UBMD, but I would like to thank them for the proposals that they did put forward. I think that this was a good process to have for the wise spending of taxpayer dollars, since we are funded by New York State. Is there any other old business anybody can think of? Okey dokey. Is there any new business anybody knows of?
Yes.
Oh, we almost got there.
I know. So the packet I got from Stat Medevac that's requesting staffing modification proposal, they have to send this to all the REMACs in the state because they're a very diverse agency. And what they're looking to do, they would like our support in that they could run their service with, air service with either 2 nurses or 2 paramedics, because they're having staffing difficulties having a nurse and a paramedic on the helicopter. Is that?
Yeah, so what it is they're requesting a waiver which has to go to each WEREMSCO in which they serve. It's more, they want to run 2 nurses, as they have a shortage of paramedics at Stat Med. What I can say is, from what I'm hearing, most of the WEREMSCOs are denying this. That's what I'm hearing.
Anyone else have any knowledge of this?
Yep. You have a specific question?
Yeah, I didn't know if anyone else wanted to add. I don't know.
Would you like to provide?
This is all very new to me. I just
Yeah, it came across my desk maybe a month and a half ago that this was something they were probably gonna ask. I think there's some concerns, at the REMAC level of sort of, what is the training of the nurses in terms of, airway management and things that a paramedic would typically do. That, I think, is one of the linchpins that some of my counterparts in the other regions are experiencing, and I've heard the same, that there's not a lot of anticipated excitement or support for this, but I'm not aware of any specific regional council votes that have taken place.
Is the correspondence directed to the regional council or to the REMAC?
To whom it may concern.
Do we know if the correspondence was intended to be addressed to the regional council or to the REMAC?
I don't know for sure.
It was sent to me directly as the REMAC, but it did not indicate whether this was seeking REMAC approval or just telling me that this was gonna be happening. That was unclear.
Is a request based on the fact that they potentially could fly anywhere in New York State? Is that the origin of this? And where are they based?
Hmm?
Where are they based primarily?
UPMC Jamestown.
Oh, probably looking.
Oh,
And they have access to a paramedic program and advanced standing for nurses to obtain paramedic certification? Let me make that a statement, not a question.
Yeah.
They have access to paramedic programs and the ability to obtain advanced standing and have their nurses certified as paramedics.
Yep.
So I don't know who needs to approve this or write letter disapproving it. I don't know if it's from us or from you guys.
All I know is they asked us to consider providing one. They didn't mention whether or not they needed or
Would the
wanted one.
REMAC like a letter from the council indicating where they would give their support for you to go?
I'm sorry, can you say that one more time?
I says, would the, yeah, well, I kind of worded that wrong.
That's okay.
I says, would the REMAC like a letter from the council as to our stand on it or
Yeah, I think,
position on it?
as a subcommittee of the regional councils, I think the REMAC could benefit from knowing the position of the council. yeah.
Okay, would that be acceptable to everybody here to do a motion to supporting or denying it, however the council wants to go?
So any motion has to be for an affirmative act, so we'd have to move to write a letter, either supporting or denying, or the better alternative may be for us to move to table it, and then it goes down until somebody moves to pick it up off the table.
Okay.
Motion to table the request for a letter of support.
Okay, I'm actually gonna.
Okay, we got that, okay.
I'm actually gonna, Karen was supposed to give me an electronic copy of this, so I will send this to you. And if you want to like respond to it and send me a 3-page essay on your viewpoints, you can send it to my email.
So the reason they're sending this is because, like everybody else in healthcare, pickings are slim. There isn't no depth on the bench, and the bullpen is empty. So,
And traveling nurses earn a lot of money.
So is it every EMS agency out there?
yeah, I get solicited all the time. It's kind of, they're throwing stupid money as nurses. I mean, every flight nurse that I've known that's worked on any of the medevacs was a paramedic first, including my classmates at U. So, if everybody says no to them, and they don't have that asset to respond, they're kind of the only game in town, who suffers? I mean, their catchment area is primarily outside of our jurisdiction.
So what you're saying is that they're primarily dual certified?
Yeah.
No, if they were, they wouldn't have to make this request because they would have a certified paramedic and a certified nurse. They're asking to fly without a certified paramedic. That's the request.
Yeah, but if you were one and you have the same skills, that's why I'm not a medic. I'm an advanced practice nurse. It's kind of moot to go back and recertify.
I think there are some physicians that would disagree with you who maintain paramedic certifications for very specific reasons.
Well, currently we have a motion on the table to table.
I'll second it.
Well, it's been seconded.
Well, then whatever.
Yeah. We had some discussion. So is there any more discussion on the motion to table? Okay, then I suggest right now we do a vote. All in favor of the motion to table? Please, okay. Any opposed? Okay, any abstain? Okey dokey. Motion has passed
Okay.
to table. You did catch the motion, didn't you?
Mhm, okay.
Okay. Okay. Anything else that's under new business? Then motion to adjourn, and I thank you all for helping and participating in the meeting and coming to make a quorum. I need a motion.
I got Don Turner already motioned.
Oh, you got it, okay.
He
Okay,
nodded.
okay, you got it, okay. Okay,
He
thank
nodded.
you all.